Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, red blood cell count, understanding MCV, MCHRDW and more. Some of the most common blood tests are the red blood cell, RBC, indices. These are part of a larger battery of tests known as the complete blood count, CBC. The information offered by the RBC indices can provide valuable insights about your current health, possible diseases you may have, or how well you are responding to treatments. /r/n/r/n as valuable as the tests are, understanding what a high RBC, low MCV, or low MCH mean can be difficult and confusing. But, with a little insight and education, you can make sense of the different tests and participate more actively in your healthcare decisions. /r/n/r/n This article breaks down the various tests that make up the RBC indices, including what high and low test values mean. It also gives examples of commonly accepted reference ranges. /r/n/r/n The RBC indices are part of the larger complete blood count, CBC. The CBC is a battery of blood tests ordered by your healthcare provider to evaluate the composition and quality of the blood cells in your body. /r/n/r/n The CBC not only includes white blood cells, leukocytes, that help fight infection, and platelets, thrombocytes, that clot blood, but also red blood cells, erythrocytes, that transport oxygen throughout the body. /r/n/r/n The complete blood count is so named because that is exactly what it does, count all the blood cells in a sample. The values are reported in different ways, sometimes by the actual number of cells in a sample of blood and, at other times, by the proportion of one group of cells to another group. /r/n/r/n In their totality, these values can tell a healthcare provider a lot about the state of your health. /r/n/r/n The first step in learning how to read any blood test report is to understand the reference ranges of values. This is the set of values between which a blood test result is considered normal. It is validated through testing patients. /r/n/r/n Simply put, /r/n/r/n it's important to note that high and low values are abnormal but, on their own, don't necessarily mean anything until they are investigated further with other blood, lab, or imaging tests. /r/n/r/n The reference range is based on the expected values within a given population. As such, the values can vary from one population to the next, or sometimes even from one lab to the next. /r/n/r/n Reference ranges may also vary depending on the equipment and testing methods used. That said, always refer the laboratory-specific reference values provided with your results. /r/n/r/n By way of example, hemoglobin values, used in part to detect anemia, are invariably higher at high altitudes than they are at sea level, and are a normal adaptation. Therefore, not only does the reference range for hemoglobin differ, but so does the diagnostic definition of anemia. /r/n/r/n Normal values can also sometimes differ by age, biological sex, and even race. /r/n/r/n This video has been medically reviewed by Chris Vincent, MD. /r/n/r/n The red blood cell RBC count is the general starting point of any evaluation of red blood cells. As per its name, it simply counts the number of red blood cells in a sample of blood. The RBC count is measured in millions of cells per microliter, 1/millionth of a liter, or cells/mca. /r/n/r/n A normal RBC count depends on age and sex. /r/n/r/n A low and high RBC count can mean any number of things, both benign and severe. /r/n/r/n Anemia /r/n/r/n Vitamin deficiency /r/n/r/n Certain medications, such as chemotherapy /r/n/r/n Bleeding in the digestive tract such as a peptic ulcer/R/N/R/N heavy menstrual bleeding/R/N/R/N hypothyroidism, low thyroid function/R/N/R/N chronic kidney disease, CKD/R/N/R/N inflammatory bowel disease, IBD/R/N/R/N rheumatoid arthritis, RA/R/N/R/N liver cirrhosis/R/N/R/N certain cancers, including lymphoma and leukemia/R/N/R/N dehydration/R/N/R/N heart failure/R/N/R/N chronic obstructive pulmonary disease, COPD/R/N/R/N pulmonary fibrosis, scarring of lung tissue/R/N/R/N polycythemia vera, a bone marrow disease/R/N/R/N performance enhancing drugs, such as anabolic steroids/R/N/R/N renal cell carcinoma, a type of kidney cancer/R/N/R/N along with the RBC count. The RBC indices provide information about the quality of your red blood cells. The RBC indices look at specific components or characteristics of red blood cells, including their size and proportion. /R/N/R/N The RBC indices also look at a protein in red blood cells called hemoglobin that is responsible for transporting oxygen from the lungs to the rest of the body. Hemoglobin is also the protein that gives red blood cells their red color. /R/N/R/N The main components of the RBC indices include the mean corpuscular hemoglobin concentration, MCHC, the mean corpuscular volume, MCV, the mean corpuscular hemoglobin, MCH, and the red cell distribution width, RDW. /R/N/R/N The mean corpuscular hemoglobin concentration, MCHC, is the average concentration of hemoglobin in a sample of red blood cells. A corpuscle is simply a term used to describe a living cell, particularly red and white blood cells. /R/N/R/N The MCHC basically tells whether you have more or less hemoglobin than what would be expected. The MCHC is measured in grams of hemoglobin per deciliter, 1/1000th of a liter, of blood, or G/Dl. /R/N/R/N A normal reference range for MCHC is between 32 and 36 grams/Dl in adults. /R/N/R/N low and high MCHC can mean any number of different things. However, an abnormal MCHC is not significant if there is no anemia. /R/N/R/N iron deficiency anemia /R/N/R/N aplastic anemia /R/N/R/N pernicious anemia /R/N/R/N anemia of chronic disease /R/N/R/N thalassemia, an inherited blood disorder /R/N/R/N iron malabsorption, as can occur with celiac disease or Crohn's disease /R/N/R/N pregnancy /R/N/R/N hemolytic anemia /R/N/R/N vitamin B12 deficiency /R/N/R/N folate deficiency /R/N/R/N spherocytosis, an inherited blood disorder /R/N/R/N mean corpuscular volume, MCV, measures the average volume of red blood cells. Any increase or decrease in the normal volume/size of a red blood cell can affect its ability to transport oxygen, leading to anemia. The MCV is measured in femtoliters, 1,000 trillionths of a liter, per cell, or FL/cell. /R/N/R/N a normal reference range for MCV is between 80 and 96 FL/cell. /R/N/R/N low and high MCV values can mean any number of things. /R/N/R/N it's important to note that a person can have anemia and have a normal MCV. This is called normocytic anemia. Causes may include /r/n/r/n iron deficiency /r/n/r/n lead poisoning /r/n/r/n iron malabsorption /r/n/r/n thalassemia /r/n/r/n anemia of chronic disease /r/n/r/n copper deficiency /r/n/r/n hemolytic /r/n/r/n vitamin B12 deficiency /r/n/r/n folate deficiency /r/n/r/n liver disease /r/n/r/n alcoholism /r/n/r/n hypothyroidism /r/n/r/n leukemia /r/n/r/n chemotherapy /r/n/r/n copper deficiency /r/n/r/n mean corpuscular hemoglobin MCH is the average amount of hemoglobin per red blood cell in a sample of blood. MCH is measured in picograms, 1/trillionth of a gram, per cell, or pg/cell. /r/n/r/n the MCH value directly parallels the MCV value, and, for this reason, some healthcare providers find the test redundant. As such, if the size of the red blood cells is large, as measured by the MCV, the amount of hemoglobin per red blood cell will be high, as measured by the MCH, and vice versa. /r/n/r/n a normal reference range for MCH is between 27 and 32 pg/cell. /r/n/r/n the possible causes of low and high MCH tend to echo those of a low and high MCHC. /r/n/r/n red cell distribution width, RDW, is a test that assesses the variability in the size of the red blood cells. A normal RDW would mean that your red blood cells are all similar in size, whereas a higher RDW means that there is more variability in the size of the red blood cells. This is called an isocytosis. /r/n/r/n RDW values are described in percentages. It is instead calculated as the standard deviation of red blood cell volume /mean cell volume, 100. /r/n/r/n a normal reference range for RDW is 11.5% to 14.5%. /r/n/r/n low RDW means that red blood cells are not very different in size from typical measurements. A high RDW means they differ in size more significantly, which can indicate the body is having trouble producing enough red blood cells. /r/n/r/n the interpretation of the RDW differs from the other blood tests in that it varies based on its relationship to the MCV. In short, the sizes and variability of red blood cells can indicate vastly different things. /r/n/r/n here are just a handful of examples. /r/n/r/n red blood cell, RBC, indices are a battery of tests that evaluate measurable characteristics of red blood cells, including their size and the concentration of hemoglobin in them. The tests include the mean corpuscular hemoglobin concentration, MCHC, mean corpuscular volume, MCV, mean corpuscular hemoglobin, MCH, and red cell distribution width, RDW. /r/n/r/n the test values can point a healthcare provider in the direction of the possible causes when compared to each other or to other blood, lab, or imaging test results. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.